I'm sorry. Hopefully we're connected now. So good morning, and thank you for everyone from braving this bad weather to make it out to this event today. This is very excited at Georgetown to participate in the Department of Health and Human Services Code-a-thon. Luckily, you guys could make it, but I am still stuck here with about 4 inches of snow and no snowplow. So I am John Jacobs. I'm the Executive Director for the Center for Financial Markets and Policy here at the University at the McDonough School of Business. And our goal at the center is to offer innovative, influential thought leadership, also discussion on critical policy and market issues related to responsible global financial markets. So we do that in a variety of ways by providing, hosting dialogues, conferences, events, et cetera, and along those lines. And we also try to rely on the heritage we have at Georgetown University being in DC, where we have access to policymakers and industry, and we try to create an environment by which everyone can come and share and engage in a real dialogue with a level playing field and no set agenda. We really look forward to seeing what happens in the next 24 hours. And so we salute you for your efforts. And I'd like to introduce at this point in time Steve Posnack, the Director of Standards for the HHS Office of the National Coordinator for Health IT. Steve joined the office in 2005, and he's co-led many efforts there, including co-authoring the nationwide privacy and security framework for electronic exchange of individually identified health information. Steve earned his Bachelor of Science in Computer Science from Worcester Polytechnic Institute, a Master of Science in Security Informatics from Johns Hopkins University, Information Security Institute, and a Master of Health Science in Health Policy from Johns Hopkins Bloomberg School of Public Health. He maintains his Certified Information System Security Professional CISSP certificate. So please welcome Steve for the official comment.
Here we go. Can you hear me now? All right, cool. Thank you very much. Appreciate everyone's flexibility today. As engineers, we will find a way to make this happen. So on behalf of the Office of the National Coordinator, in collaboration with the Chamber of Digital Commerce and our colleagues at Georgetown and elsewhere, thank you very much for participating in this Code-a-thon. It's very exciting. We've, if you read some of the background, have been, interested in following blockchain and distributed ledger technology and its application in healthcare and how it can really converge and intersect with a number of different other exciting technologies that we have on the horizon. So, your mission today, if you choose to accept it, is to tackle one of those 3 tracks that we've identified and are really looking to see in general some innovative and inspiring solutions relative to what can be done in this area using distributed ledger technology. So very much interested in seeing what everybody can come up with. Appreciate everyone's flexibility. Who would have predicted that we would have had a quasi major snowstorm, at least by DC standards, in the middle of March, but why not add a little bit more excitement to the normal hype and hyperbole associated with blockchain? I will end my brief remarks because I know that time is ticking for all of you, and turn it over to my colleague, the current Acting National Coordinator for Health Information Technology, John White.
Thank you, Steve. Am I audible?
Yes, at least to me.
Okay, very good. All right. Thank you so much for everybody for getting on the phone. I will add to the thanks and say really appreciate everybody making the effort to connect with us, either for those of you who braved it and are out there, in the Marriott, or for those who are virtually with us. As Steve said, my name is John White. I'm the Acting National Coordinator for Health IT. That's a role that I will fill until Secretary Price names a new National Coordinator, at which time I return to my day job as the Deputy National Coordinator. I'm really excited to be here with you today. Appreciate all your interest in this particular topic. Want to give a particular shout out to our Blockchain Challenge contestants. This is all about you all. So thank you for being in the room, real or in virtual today. Special thank you to John Jacobs and the Georgetown University McDonough School of Business for hosting us today, and especially to our partners, the Digital Chamber of Commerce, for collaborating with us to put together this great event. Want to offer you a bit of background about ONC in case you don't know it. ONC is the Office of the National Coordinator for Health IT. We're a staff division of the U.S. Department of Health and Human Services. We were created by executive order in 2000, way back in 2004, under President George W. Bush. ONC was authorized in law in 2009 through the enactment of the Health Information Technology for Economic and Clinical Health Act, or HITECH, which was part of the American Recovery and Reinvestment Act. Since then, we've had a really strong focus on spurring health IT adoption, use, and interoperability through a host of different efforts. Some of those include ONC's Health IT Certification Program, our Interoperability Standards Advisory, our Health IT Playbook, Model Contract Language for Providers, and various cooperative agreements to advance health IT adoption and health information exchange. Since the passage of HITECH in 2009, there's been a sea change in healthcare in terms of the use of information technology and digital information. Now, nearly every hospitalization and most doctors' office visits now have a digital footprint. There's an extraordinary amount of electronic health data that exists now that just simply didn't exist a decade ago. Going back to 2008, it was 17% of physicians and 9% of hospitals that had at least a basic electronic health record. But in 2015, it's 96% of hospitals and 78% of physician offices using certified EHR technology. So the impact of this dramatic increase in health IT adoption goes beyond digitizing paper health records. It's had real benefits for real patients across the country. And I know some of this from my personal experience, and I hope you all have seen the same in your lives. But to build on this collective momentum, we got to continue making progress on interoperability, usability, privacy, and security. Today, health information is often trapped in data silos. There's a real tension between data liquidity, letting data flow to where it needs to go, and keeping individuals' health information private and secure, especially with widespread use of new technologies. So it's important not only to get the data moving, but to get it moving in a safe and reliable way. And with that in mind, ONC focuses on improving the ability of healthcare providers and organizations to send, receive, find, and use health information. Looking ahead, we want to be in a place where we can expand current data sources and users in the interoperable health IT ecosystem to improve health and lower cost. We outlined this in our 2015 interoperability roadmap, and we continue to take actions to make health information available where and when it's needed most, and to move the needle on emergent technologies and technology used in other sectors. That's also why we've launched challenges and funding announcements, which are intended to unlock electronic health data for innovators like you, so that consumers can can aggregate their information in one place, and that providers can have a more user-friendly experience, and that new products and standards can improve the flow and security of information across healthcare teams. So in 2016, we issued a prize challenge to explore the use of blockchain technology in health IT to address privacy, security, and scalability challenges of managing the flow of health information. Specifically, we set out to learn more about how it might be used in health and health IT to protect, manage, and exchange health information. And we were thrilled, really, by the extraordinarily and genuine interest in the challenge. We received over 70 white paper submissions from a range of organizations and individuals, and awarded 15 winners based on several factors, including the paper's pros, solutions, or recommendations for market viability, creativity, the ability to inform and foster transformative change, and the potential to support a number of national health and health information objectives, including advancing the flow of health information. We're excited to have partners across a variety of sectors that are helping move this along. I personally have always thought that an important role of the government is to help build the bridges highways and infrastructure that enable commerce and promote the general welfare. The highways of the future, especially in healthcare, are virtual, and we need to help foster a sustainable ecosystem of digital asset management for healthcare. And we continue to rely on your innovation, input, and insights to drive us forward. So I know that was really dense. Sorry, it's just we've been thinking about this a lot, and we're pretty excited both about the potential for this as well as taking a good hard look at it. And we're excited to see what you can do in the next 24 hours. So thank you so much. It's a real pleasure to be here, and I'm looking forward to seeing how you're going to use data sources for identity management, data aggregation, and data linkage. And now I get the pleasure of turning it over to Perry Ann Boring from the Digital Chamber of Commerce. Thank you so much.